So today we're going to talk about stroke. Stroke is an emergency. Millions of brain cells die per minute during a stroke. So treatment within the first hour greatly increases the chance of recovery without disability. So to recognize a stroke, you want to use the acronym FAST. FAST, the F stands for face. You ask a person to smile. Does one side of the face droop? Arms, A stands for arms, and you ask the person to raise both arms, and they should raise the same unless, of course, they've had a previous injury. S is for speech, and you ask the person to repeat a simple sentence and see if their words are slurred. And T is for time, because any suspicion of a stroke needs to be treated immediately. So the type of the stroke a patient has affects their type of treatment and recovery. So a TIA, which is a transient ischemic attack, is often called a mini stroke because blood flow to the brain is blocked for only a short time. Usually, when the symptoms resolve, the patient has a complete recovery. An ischemic stroke is the most common type of stroke, and it happens when a blood clot blocks blood flow in an artery within the brain. The goal of treating this patient is within 45 minutes so that they would recover without disability. So obviously it's something we need to react to quite quickly. A hemorrhagic stroke happens when an artery in the brain leaks blood or ruptures. So when a patient presents with a stroke, the first thing that needs to be done is a CTA test to determine if it's hemorrhagic or if it's ischemic, because a patient that has a hemorrhagic stroke could not receive the clot buster medication that they would receive for an ischemic stroke.